recently met a lady who was all in tears and was seriously having pains, and she was frustrated because she had tried different things. Her friends had told her do this and do that. I was asking her, what were your symptoms, or what are your symptoms? And she started complaining that she uses the toilet so frequently and she's having these crazy cramps. She cannot explain it, back aches and this and that. And I discovered that she had UTI. So in this video, you will understand what UTI is and how to knock it out. Are you tired of dealing with UTI? I'm talking about urinary tract infection. In this video, I'm going to be showing you how you can deal with urinary tract infection. I'm going to be discussing what urinary tract infection is, the causes, the symptoms, and how to manage it. I'll be talking about the natural remedies and the not so natural remedies, just so that you can kick UTI out of your body. Welcome to Healthphilic. I'm happy to have you on this channel. If you're here for the first time, welcome. And if you're a returning subscriber, you are very, very welcome. I'm happy to have you all here. So without further ado, let's go straight into the video. Before we go, have you subscribed to this channel? Okay, do that right now by clicking on the subscribe button, put on the bell notification sign beside it, so that when I upload useful videos like this one, you can get notified and watch it. Alright, let's get right into the video. So what is urinary tract infection? Okay, I want you to know that throughout this video I'm utilizing UTI and exchanging it for urinary tract infection. It's so that I don't twist my tongue, so accept it that way. UTI is an infection of the urinary system or urinary tract. I'll be linking a resource in the description box below where I explain various forms of medical terms. In fact, they are simplified in a way that you can understand. There I explain what infection means. So this video is not about those medical terms, but infection simply refers to an alteration in the body function caused by microorganisms. Now, microorganisms are organisms that cannot be seen with the naked eye. Let's go back to UTI. So UTI is an infection that affects the urinary system. Now, what is the urinary system? The human urinary system is made up of 2 kidneys, 2 ureters, 1 bladder, and 1 urethra. Now, before you're confused, let me explain what that means. The function of the urinary system basically is to get waste products out of the body. Aside from the anus, the urine carries and takes out waste products from the blood. The kidneys basically function to filter the blood and get out the waste products from the blood, and then it passes to the ureter, which is like a form of transport, into the bladder, where the urine is stored for a while before it is passed out of the body through the process of micturition or urination. Like I said earlier, urinary tract infection is a painful condition that affects the urinary system. Let's look at some symptoms of urinary tract infection. Some of the symptoms of UTI include burning sensation during urination, cloudy urine which may be filled with blood or pus, backache, the urge to urinate frequently, urge to empty the bladder even when there is nothing there. You could even develop a fever. These are the major classical symptoms of UTI. So now let's go right into the causes of UTI. Now, one of the microorganisms that is very common to cause UTI is Escherichia coli, shortened to mean E.coli. Now, more specifically, the uropathogenic E.coli is the one responsible for UTI. Now, you must note, UTI can affect any part of the urinary system. A lot of times, people focus more on the bladder. It can affect any part. It can affect the urethra, the bladder, the ureter, and even work its way up to the kidney. And at that point in time, it is very dangerous. And that's why when you begin to have symptoms of E. coli, it's not something to joke with. It is something to address head on, because the bacteria keeps working its way up. A lot of times it starts maybe at the bladder where the urine is always collected. Then the bacteria could work its way up to the ureters, then even find its way into the kidney and cause a lot more complicated issue. I'm sure you don't want that. The bacteria that can cause UTI include Staphylococcus, Klebsiella, and the likes. Basically, this bacteria gain entrance into the urinary system via the urethra for the males and for the females through the urethra. Now, when this bacteria has gained entrance through the urethra, it gets into the bladder, attaches itself to the wall of the bladder, and it begins to reproduce there. When it attaches to the bladder, it produces a biofilm, and that biofilm is a process or a way by which the bacteria protects itself from the immune system of the body. And so sometimes that's why the natural immune defenses of the body is not enough to wipe out that bacteria from the bladder. And so an infection eventually results in the blood, a blood infection, and that's what accounts for the generalized malaise and fever that is felt most of the time. One of the primary causes or sources of UTI in females is through intercourse. Through sexual intercourse, the bacteria in the anus or wherever place find their way one way or the other to the urethra of the female, and voila, UTI results. Like I said before, UTI occurs 4 times in females compared to males. And contrary to what people always say, that UTI is caused by sitting on maybe toilets and all of that, well, maybe, but not primarily so. If the bacteria does not find its way into the urethra, UTI will not result. So you cannot just by using a toilet, if you take proper measures, even using a toilet, and you don't get the bacteria into the system, UTI would not happen. Other risk factors of urinary tract infection includes urinary catheterization, the use of catheter in females and males. When they have enlarged prostate, it could also be a risk factor for the occurrence of urinary tract infection. Remember, I told you it doesn't just occur in the bladder, it can occur anywhere. So when the prostate is enlarged, it can hinder the flow of urine properly from the bladder. The prostate is found at the neck of the bladder, in case you do not know. So when the prostate is enlarged, it can obstruct the flow of urine from the bladder, and so urine will stay longer in the bladder. Then there's a risk for the bacteria in the bladder to reproduce, blah blah blah, and UTI. Also, women using contraceptives like diaphragms for birth controls, or using spermicide gels in their private parts, it can put them at risk for urinary tract infection. After menopause, there's also a decline in the structure and the consistency of the urinary tract. It can also make a woman more vulnerable to developing urinary tract infection. Now, how can you know if what you're feeling is actually UTI or something else? Okay, the first way to diagnose UTI is by taking a test. So you need to do a urine analysis, where you check the amount of microorganisms in the urine, to check the number of leukocytes, that is the white blood cells that fights off infection. You check them also in the urine. Leave that to the technical guys to do, but you should know that you can walk up to any laboratory and tell them that you need to get a urine analysis done, or it's called urinalysis done, so that you can ascertain if there is actually an infection in your urinary tract. Urine microscopy is another step you should take if you want to know if you have UTI, where urine is taken, is cultured. Leave that to the microbiologist or the scientist. But you should know that if the result comes out positive, that is, if bacteria like E.coli are present in your urine, then it is confirmed that you have UTI. The next pressing question is, how do you treat urinary tract infection? Well, at Health Village, we believe that taking medications without proper medical direction may be very serious and may cause severe consequences to health. But there are certain things you could do naturally first to eliminate UTI, and afterwards I'll be talking about the other things you could do chemically or scientifically to get it out of your system. So one of the first things to do when you begin to feel symptoms of urinary tract infection, can you guess what it is? It's to drink a lot of water. Drink a lot of water. In fact, double your water intake. When you begin to feel that symptom, you need to take water twice as much as you would normally do, because that way you're getting enough urine to get into your bladder, and it's more or less like you're flushing your system. You're flushing your system. It works like magic. Trust me. It's a natural way. It's a natural method, and definitely it works for mild cases of UTI. I'm not talking of UTI that has been like for ages. I'm talking of UTI symptoms that are just happening. When you take enough water, you flush out the bacteria, and you'll be all good. Another thing that you should do if you're feeling symptoms of UTI, I'm talking of a natural method for you to get rid of UTI, is to ensure that you empty your bladder as frequently as possible. Now, I already told you to take enough water. Now, when you take enough water, you need to empty your bladder. As the urine is being formed, if you do not empty the bladder, you can create a medium for the bacteria to reproduce so much. But if you empty the bladder almost immediately as urine gets into the bladder, then you're giving the bacteria no room to stay. Another thing that you should do is to take a lot of citrus, a lot of fruits with vitamin C. Now, let me tell you the catch to that. Vitamin C helps to increase the acidic content of your urine. When anybody hears acid, everybody's scared. Nobody likes acid. Nobody likes acid. Even the bacteria does not like acid. So when your urine is acidic, it kills off the bacteria because they cannot conveniently survive in an acidic environment. So you need to take a lot of citrus, take oranges, whatever fruit that contains citrus will do the job. Another natural remedy to UTI is cranberry fruit or cranberry supplements. You can get this fruit supplement in your local store, online, find a way to attach some of the links where you can get them in the description box. You can order them. Just like cranberry works, also Oregon grapes works that way. It also causes the bacteria to detach from the bladder wall. And there's an addition to that. Oregon grapes have an anti-inflammatory property where the infection, a lot of times when infection happens, it happens with inflammation, where there's like a proliferation. I'm beginning to use a lot of medical terms, forgive me. But yes, inflammation is just like the body responding to this breach in, like a break in transmission, kind of. So Oregon grapes helps to reduce that inflammation and thereby causing the solution that we want. Another thing that you can do to manage or treat UTI naturally is to take yogurt or probiotics. Probiotics are bacteria, good bacteria. And so what does good bacteria do? When you take them, they go on to fight off the bad bacteria and eliminate them from the system. Now, where does yogurt come in? Yogurt a lot of times contain good bacteria, probiotics like lactobacillus and the likes. They are good bacteria. When you take them, they help you to flush out UTI. Now, the last thing that I'll tell you to do as part of the natural remedies to eliminate UTI is to apply it. Now, apply it to the lower portion of your belly where you most likely will be feeling pain during the symptoms of UTI. So when you're feeling the pain, you apply it to the lower part of your belly. You could use a hot water bottle, you could use a warm cloth, whatever. When you do that, coupled with drinking a lot of water, taking the cranberry juices or supplements, Oregon grapes, vitamin C, everything, the UTI will have no place to stay. But you need to know that this is very effective for mild to moderate urinary tract infection. If your symptoms begin to last longer than they should, then you should definitely see a doctor and a licensed practitioner that would do and run tests like should be done and prescribe the necessary antibiotics. And this will lead me to the not so natural methods to cure urinary tract infection. Like I said before, taking medications without the guidance of a trained medical professional can have severe consequences. So you need to be careful when taking medications. Make sure they are taken in a properly prescribed manner. So now let's go to the first thing that we do when you want to treat urinary tract infection. The main drugs to treat UTI are antibiotics. A lot of people know antibiotics. But there's a catch to antibiotics. You don't just take antibiotics anyhow. Antibiotics are majorly drugs that work and fight against bacteria. That is what they do. So when you take them indiscriminately, these bacteria also modify their forms and their processes. When they become adapted to the antibiotics, possibly when you're supposed to treat an infection with a lower grade and you take a higher form of antibiotics, it works. Although when you now need to take a lower grade antibiotics for something simple, if you use it, it's not going to work, because your body has adapted to a higher form of antibiotic. The bacteria in your body are now resistant to the lower form of antibiotic, and that is trouble. So you do not just go ahead taking antibiotics indiscriminately. It is not good for you. So what are the drugs commonly used to treat urinary tract infection? The common drugs used to treat urinary tract infections are nitrofurantoin and commonly sold as Nectar or Urotoin. I'll put the names there so you can see them. You can order them online, you can check them in your local store. These drugs are good urinary antiseptics. They eliminate the bacteria straight up and give it no time and no chance to stay in your urinary system. It is used 5 days a week, 1 in the morning and 1 in the night, to achieve its best result. Now, one thing you should know is that don't start medications without completing them. They are more fatal than not using the drug at all. Take it from me. If the first option does not work, there are other options that you could use. There are other drugs you could use, like amoxiclav, usually sold as augmentin, like fluoroquinolones. You can, when you use those drugs, your symptoms should resolve within the first 36 hours. So these are some of the things that you can do, and I'm sure that with these methods, you're going to be kicking out urinary tract infection from your system. One thing that you should also do to get rid of urinary tract infection is lifestyle changes. At the time when you're having urinary tract infection or the symptoms, or you're treating it, that is not the time to still continue to take alcohol or cigarettes, nicotine, and the likes, because these substances have an effect on the bladder. They irritate the bladder, and so you want to, during the period and as much as possible, keep your bladder and your kidneys, your system as clean as possible. So there you have it, the causes of UTI, the treatment, the symptoms, what it is, everything I promised I gave you in this video. Thank you for watching till this point, and if you have not subscribed to this channel, consider doing that now, because there's a lot more that I want to share with you. There is so much more that I want to teach you. I want to hear your questions. I want to answer your questions. So feel free to use the comment box to tell me the things you don't understand. Ask your question. Make suggestions on the videos you would like me to shoot next. I take all those comments very seriously, and I respond to them personally. If you have not subscribed, kindly do that now by clicking on the subscribe button and the notification bell right beside it, so that when I post a useful video like this, you can get it and you can watch it, you can get information from it, you can be educated, and you can apply it into your very lives. So please like this video, please share this video, please comment. This will help YouTube publish the video and make it available for many more to see. This would be a really great form of support for me and for this channel. I love you so much, and I'm rooting for you. I am 100% committed to your health. I promise to be much more available on this platform. So if you have your questions, please do send a DM on WhatsApp, on Instagram. or drop your comment in the comment section below. So thank you for watching, guys. See you in the next video. Bye.